And we're back with actually two of my favorite bleeding hearts sitting at the table with me. Denise Mayes from the Colorado ACLU. Denise, how are you today?
I am well, thank you, Mike.
Terry Hurst from the Colorado Criminal Justice Reform Coalition.
Coalition, yes.
Yep.
Thank you for letting us be here today.
I'm not sure which one is more of the bleeding heart, but we're happy to be here with you.
Fantastic.
Exactly.
All right, so first let's do this. So the ACLU, of course, is a established, nationally branded civil rights organization. So politically astute people and people high knowledge voters obviously already know what the ACLU is, but you're with the Colorado chapter, which same mission but focused on Colorado as it relates to the mission.
Right.
Is that a fair assessment?
That's a fair assessment. We just promote civil liberties for all of Colorado.
All right. And Colorado Criminal Justice Reform Coalition is a different animal because you are a Colorado-specific organization. And you're also small. I think you operate out of some guy's second bedroom, right?
Pretty much. I mean, so we're a staff of 4. We are a small nonprofit 501c3 that began in 1999. So our mission is to end mass incarceration.
Give me the 1-minute elevator pitch you might throw at somebody to explain what the heck you do.
I would say that, again, we work towards ending mass incarceration, that we have an over-reliance on the criminal justice system, and our organization tries to change policy to help reduce the amount of people involved in the criminal justice system, and we also act as a resource for people and their families that have been impacted.
Fantastic. All right. So we're in this legislative session, so ACLU has an interest in criminal justice issues. Sure. Obviously you do. It's right in your name. There's this interesting little sub-theme running through some bills in this year's legislature. They're not big, sexy themes, so they don't get a lot of attention. But the theme, at least from my perspective, and tell me if I'm wrong, the theme seems to be there's some bills that put the safety and well-being of some first responders, police, and healthcare professionals, and the privacy and dignity of victims ahead of kind of this idea of let's just make everything prosecutable and hope that the DAs exercise their discretion. For the bills we're going to cover here,
that makes
you agree?
sense. Yes. I think that's exactly right.
Well, then let's jump in and talk about these bills, because both of your organizations support these bills, right? You're both on board with these? All right, great. So they've all gone through the Senate, heading into the House.
Correct.
All right, so first off, we're going to start off with SB 30, Prostitution Defense for Human Rights Trafficking, and this is Morgan Carroll and Bill Cadman's bill. So you have the former state Senate president and the current state Senate president co-sponsoring a bill together. What does this thing do?
Well, basically, it allows victims of human trafficking to raise the fact that they were in human trafficking as an affirmative defense to being charged for prostitution. I mean, there's a lot of both men and women that are part of a human trafficking ring, and they are coerced into prostitution, and this allows them an affirmative defense. I mean, the real simple charge of prostitution, you just fulfill the elements and you're done. But this at least allows for an affirmative defense, which had not been permitted before.
Okay, so let me see if I got this straight then. So the cops do a sting, and they bust some Johns and they bust some prostitutes. And the prostitute says, well, I've been coerced into the sex trade by traffickers. And they say, well, tell it to your lawyer, and you can still be charged for the prostitution, despite the fact that you were coerced into the sex trade. And so that actually can happen now, right?
Correct.
All right, so this bill would undo that. It would give either the prostitute, the person engaging in the sex trade, an affirmative defense to say, look, I was coerced into this. It wasn't my idea, right?
Right.
And please don't. I can't be charged.
Correct.
Well, you would still be charged
initially. You just have to
prove
that you were a victim of a sex trafficking.
Yes.
And you were talking about before the show that there's a little glitch in here though with regard to how the person being charged with prostitution would actually prove this.
Correct. The human trafficking victim would actually have to prove by a preponderance of the evidence.
Would you got to get your trafficker into court to say, yes, I trafficked? Yes, as a matter of fact, I have been trafficking this young lady.
That is part of I mean, human trafficking is difficult to prove. And so, yeah, it does put somewhat of a burden on the victim that was not in the original bill. And when you spoke earlier about just the dignity of the victims involved, I mean, people that are coerced into prostitution through human trafficking. I mean, there's a lot of trauma involved in that whole experience, and now the victim has to come and make that case, and it's not real clear to me how they would do it without bringing in the John, for example.
Right, and interestingly enough, so in many cases, women who are brought here for the purposes of the sex trade through human trafficking, they might very well be right here and right outside the door is the United States of America, where she could actually go and say, hey, I'm the victim of sex trafficking, and get help. I mean, there are organizations out there that would say, yes, come on and we'll take care of you. But they might be from a culture in another country where they don't know that. They don't know they can do that because maybe they're from a place where you can't do that.
Right.
And so it's kind of a double whammy. They have to prove this, and they don't even know how to go about proving
That's
this,
exactly
or how to
right.
deal with our kind of system, or the fact that we have due process, or the fact that they're the victim and not the criminal.
Correct.
Yeah,
Correct. And I
exactly.
even think even knowing all that, there still is the fear.
It would still be fear, and
There's
there'd still be
the fear
difficulty.
of the sort of the retaliation that a John may take, or there's still, I mean, there's still some barriers.
All right.
Let's face it.
So this thing
Yeah.
passed out of the Senate,
Yes.
headed into the House.
Correct.
Right.
Yeah.
And you see a problem with this passing?
I
I
don't.
don't. Yeah, I
don't.
don't
It would
either.
be a, it would
It would
be
be bizarre.
a,
To, it would, you know what? I
yes,
got to tell you.
it would be a sad day.
I got to tell you something.
Right.
That would be. I would not want to be the vote that killed this. To
Exactly.
Be honest with you. All
Right.
right.
Yeah.
All right. All right. So then let's move on to the needle prick bill. And let me just be clear. Needle prick is not my online screen name. It's actually what the bill does. So I just want to make that clear. All right.
It's not your
And
your
it's
Twitter handle.
No, hardly.
Okay.
All right. So we have this ridiculous war on drugs, and in the war on drugs, simply being in possession of paraphernalia that can be used to ingest these illegal drugs is in and of itself a crime,
Yes.
right? So if I have a hypodermic needle in my pocket, and there's, well, first off, simply being in possession of the needle itself is a crime, right? Unless I have a prescription for it?
Correct.
Is that-
Yes.
That's
all
right.
And then if there's residue of an illegal drug on that needle, now I'm in possession of paraphernalia and an illegal drug.
You can be charged with a controlled substance, even
right.
if it is just a residue.
Okay, but here's the problem. When the cops show up on this, let's just say that I'm homeless and drug addicted. That means I have a pretty darn good chance of coming in contact with the police at some point. In fact, quite often, right? And so then the police go to search me, stick their hand in my pocket, prick themselves on my needle that I've been using and maybe sharing with my fellow drug addicts. And now what happens? What happens? Take it from there.
Well, there's a potential of infection, all
Right.
kinds of things, and there are problems with that. I mean, one of the biggest selling points of this is it provides a good safety net for law enforcement
Yeah,
or
so
first
this-
responders.
So this is
Right.
like, but it's not just cops. It's
You're right,
paramedics,
first responders.
nurses in
Exactly.
the hospital, cutting someone's clothes off. God
Right.
only knows where you
Right,
can come
exactly.
in contact with
Right.
these needles. All right.
And again, currently we do have participant exemption for individuals who are participating in syringe exchange programs. They are currently exempt if they were to be questioned by police officers. They can say, they
Right.
can show their card and say, I'm a participant at a syringe exchange program, therefore they're exempt from the paraphernalia and the controlled substance if there's residue. That being said, there's only 7 syringe exchange programs in the state of Colorado. So for the vast majority of the state and for people who are injection drug users, they do not currently have this exemption, so that if they are stopped by the police, they can be charged with paraphernalia and a controlled
Then
substance.
take me through the scenario that the bill fixes. So I'm in the park with my syringe in my pocket, and the police are about to search me, and I say, "Officer, I have a syringe in my pocket, and it's a used syringe."
Yeah, I mean, that's
And I tell him that, and he says, "Oh, okay. So what happens now? Am I now exempt from charges for the possession of that syringe?"
Exempt from charges for the syringe and any residue. Now, if you have any other drugs on you or anything else on you, you
So
would
only
still be
for
charged.
so only
but it
for
would,
the
it
so only
carves
specifically
out,
for that carve out for that.
You
Correct.
bet. And
So-
again, it's a preventative measure for law enforcement. There is a national statistic that showed 30% of law enforcement at some point in their career will be accidentally stuck by a syringe, which is a large
that's
public
a pretty
health
number.
issue.
Yeah,
That's a big
exactly.
number.
Exactly.
All right, so I guess we can. So this bill is passed out of the Senate. Right.
And it's up tomorrow,
It's up
actually.
tomorrow. It's up. So tomorrow. So the show will be airing Friday.
Oh, okay.
So it's up Friday.
It's our-
right?
okay.
Okay. Great.
Right.
So we can just call this bill a net reduction in drug war stupidity bill. Basically, is what we
Yeah,
can
I'm
do.
fine to call it that.
Pretty
yes.
much. I mean, it would be ideal to see a full decrim bill, but this is as good as we can get right now.
Yeah.
So
it's a good step.
can I not just go buy a syringe unless I have like a prescription for a drug that requires a syringe?
No,
mean, just-
pharmacies
no, go
can
ahead.
sell
Yeah.
single syringes.
Right.
To,
An empty,
to anybody?
Yes,
Oh,
I mean
okay.
there's a handful. It's not every pharmacy, but there are a handful of pharmacies, in particular in the Denver metro area that I'm
Yeah.
aware of that sell syringes.
Okay, sounds good. Well, let's move on to the next bill. This is sex assault reporting. Now, I hate going to emergency rooms, not because they're just you don't want to go to an emergency room because something bad has happened.
Right, exactly.
They are the most intrusive places that you go into the emergency room with a cut on your hand. And the next thing you know, you're getting hammered with questions. They don't want to just stitch up your hand. They want to know exactly what happened, how it happened, et cetera. It almost seems as though healthcare providers have been co-opted into being basically proxies for the criminal justice system. And they're obligated to, if you came in to the hospital and I was the attending doctor and you told me that you had been raped, and you were seeking medical treatment, I am currently obligated to call the police. Is that right?
Yeah, right.
Right.
I was going to say that.
And even if you said, please don't call the police, I'm obligated as a licensed professional that I have to call the police.
There are a lot of laws that have created these sort of obligations.
Okay, so tell me what's the workaround for this bill? What would this bill undo that is currently being done?
Well, so this bill gives a little more freedom and leeway for victims or for individuals who have experienced sexual assault. So say somebody wants to go through with a medical exam, but may not want to participate in the law enforcement process. They can go ahead with that exam, but say, you know what, I don't want to move forward. So that's one of the provisions in the bill. It also allows.
Wait a minute. Well, let's back up for a second. So will the healthcare provider be obligated to honor that?
Be obligated to honor that.
Her request?
As
Yes.
far as I know, yes.
So they can't go ahead and say, well, we'd love to honor that, but you know what, I really think this should be reported. They have to.
Right. In fact, that's essentially one of the carve-outs in the bill, right? What would otherwise be the responsibility of the healthcare provider suddenly becomes an exception when the sex assault victim says, hey, I'm not ready yet.
Okay, so go ahead.
No, that's okay. And then the other exception is that if someone wants to just report anonymously, like they don't have to
Give their
disclose
name
their name or any information, but they still want to share that this assault happened, but they don't want to proceed with the
Right, with actually
charges
being
or
named.
anything,
And
yes.
Right. And then, it's another one that encourages, hopefully, sex assault victims to come forward, but come forward on their
Right.
own timing.
Yes.
Right, because if you're not ready to involve the authorities, you might be hesitant to come forward for treatment because you know that.
Correct.
Because the healthcare provider is obligated now to call the authority.
Right, and frankly, really, at the end of the day, it doesn't really give law enforcement a particularly good witness, right? I mean, if you have someone who has to kind of be sort of coerced and brought along, I mean, it's not necessarily the best sort of evidence that you can get from
They
a
don't wanna
witness
be
either.
there.
Right, right. So better to get the friendly witness, right? The friendly victim who's going to make the charge.
You see any chance this doesn't pass?
I
I
can't
would be
imagine.
shocked.
Right.
Again, and
It's
again,
another
boy,
one.
what I hate
Yes.
to be the
Exactly.
male lawmaker
Right.
who killed this bill.
Right.
Right,
Exactly.
Right.
Exactly.
And again, because it hopefully will encourage people to report. Again, without the mandatory reporting there. If people were fearful of reporting because of that, this will encourage more folks to come forward.
Yeah.
Okay. I would be remiss if we didn't do, as long as we're all here at the table, a eulogy for Senate Bill 6, civil asset forfeiture reform, or as I like to refer to it, legalized government theft. Rookie state Senator Laura Woods introduced Senate Bill 6, which would have fairly significantly reformed our very predatory civil asset forfeiture laws here in Colorado. The bill died a bipartisan and tragic death in the Senate Judiciary Committee.
Correct.
Bipartisan death. Also had bipartisan support, interestingly enough.
Yes.
Give us the ACLU liked this bill.
Very
You supported
much.
it. CCJRC liked this bill.
We were involved with it, yes.
Independence Institute liked this bill. We wanted to see it pass. By the way, you weren't around in 2002, and I don't believe you were.
I was not, but it was the two
But
organizations
yes,
And so in
that worked on that bill.
2002, State Representative at the time, Sean Mitchell,
Yes.
conservative Republican,
Yes.
State Senator Bill Thiebaud, a liberal Democrat, the Colorado Criminal Justice Reform Coalition, the ACLU, the Independence Institute, the Colorado Union of Taxpayers, all came together
Right.
and reformed civil asset forfeiture law in Colorado.
What a great
You don't
bill.
get
Really, what a
and
great
what a
law
great
that
bill. By
was.
the way, you
was.
don't get to take the whole bite at once, though, and so
Correct.
there was more that needed to be done.
Right.
And so 12 years later, Laura Woods introduces a bill to do some more, and it died. And but I think that it was important that we had the debate again because it's been a long time. So there's a whole new crop of lawmakers who had no idea what happened in 2002.
Correct.
There's a lot of people at the Capitol, lobbyists, et cetera, who don't understand what happened in 2002.
Right.
So I think it was valuable to have the debate again. And I think Laura
agree.
Woods did a fantastic job for a rookie.
I want to give her a big
who,
shout out. She did a very good job, not only just in her stakeholder meetings and drafting the bill and, and getting it on the hearing calendar, but her her presentation of the bill, I thought, was just terrific. It's hard for me to imagine that it could have been defeated, frankly, because it was very well done. And one of the things that the ACLU says all the time, right, and you tag the bill perfectly, is, you know, who do you call when it's the police that are robbing you, right? I mean, this is a situation where it is. It's
okay,
legalized.
Well, let's see, you said an interesting thing. A lot of people watching might be going, what the hell are you talking about?
Right.
So the police pull me over. I have $20,000 in my pocket, and they discover it because I give them permission to search me, or they search me, or whatever. And they say, "Where'd you get the money?" And I said, "I had a great weekend in Vegas." And they say, "Well, I'll tell you what, we're going to send you on your way because we have nothing to charge you with, but we're going to keep your money, and we're going to charge your money, and and I have to then go prove that I obtained my money legally to get it back. They don't have to prove I obtained it illegally. That's fair assessment of what's going on at the moment.
That's right. I mean, what typically happens, though, is, I mean, and the genesis of this whole civil forfeiture world was to not let criminals crime pay, right? So you would get a lot of money, for example, in a big drug deal, and then why do you get to keep the money? So the whole idea is the government seizes it while they investigate further and decide
but we flipped
whether,
it on
in
its
fact,
head. Look, oh God, we're out of time. We got to go. Denise, Terry, thanks so
how
much.
quickly that happens.
Yes.
Thank you.
Thank you.
All right, we're closing, so we can just keep chatting.